Welcome to This Week in Neurosurgery. This week we're covering 10 notable papers spanning major advances in neuro-oncology, the rapidly evolving world of brain-computer interfaces and neuromodulation, and new evidence to refine our daily clinical practice. Let's dive in. In neuro-oncology, the push for more precise, less invasive diagnostics continues. A systematic review in the Journal of Neuro-Oncology assessed the utility of liquid biopsies in pediatric brain tumors. Across 27 studies involving nearly 1,000 patients, cerebrospinal fluid, or CSF, emerged as the clear winner. CSF-based circulating tumor DNA detection rates were high, ranging from 51 to 100% in tumors like diffuse midline glioma and medulloblastoma. In contrast, plasma showed limited sensitivity, and urine-based detection was negligible. Notably, CSF methylation profiling showed up to 92% concordance with tumor tissue, underscoring its potential for molecular diagnosis and monitoring. On the therapeutic front, a paper in Cell explores why some patients with recurrent glioblastoma respond to CAR T-cell therapy while others don't. In a recent phase 1 trial, researchers performed deep immune profiling of CSF and tumor samples. They found that while CAR T-cells became activated in all patients after infusion, the key difference was in the host's endogenous immune response. Responders were characterized by an expansion of cytotoxic natural killer cells. Non-responders, on the other hand, showed an expansion of regulatory T-cells and had an abundance of immunosuppressive myeloid cells at baseline. This suggests that successful CAR T-cell therapy in GBM isn't just about the engineered cells, but about their interplay with the patient's own immune system, pointing toward future combination strategies. Finally, for established treatments like gamma-knife radiosurgery for vestibular schwannoma, a study in the Journal of Neuro-Oncology asks if we can reduce side effects by refining our targeting. In a retrospective study of 286 patients, researchers investigated a potential link between radiation dose to the semicircular canals and the onset of acute vestibulopathy, that is, new imbalance or vertigo, within a week of treatment. They found that the maximum dose to the canals was the most strongly associated factor. Patients receiving a max dose of 10.5 Gray or higher had a significantly higher rate of these symptoms, about 35% versus 18%. While this is an exploratory threshold and needs prospective validation, it suggests that paying closer attention to the dose delivered to the semicircular canals during treatment planning may help minimize post-procedural vestibular dysfunction. Next, 2 remarkable papers from Nature Medicine highlight major strides in functional neurosurgery and brain-computer interfaces, moving futuristic concepts into clinical reality. First, we have a report on the long-term independent use of an intracortical BCI for speech and cursor control. The study follows a man with paralysis from ALS who used the BCI at home for nearly 2 years without any researchers present. The results are stunning. He used the system for over 3,800 hours to communicate with family, control his computer, and maintain full-time employment. He generated over 1.9 million words at an average speed of 56 words per minute. For a 125,000-word vocabulary, the word accuracy was consistently over 99%. This demonstration of reliable, long-term, independent home use marks a critical step toward making this technology a practical assistive tool for people with severe motor impairment. In a similar vein of technology adapting to patient needs, another paper in Nature Medicine details an activity-dependent adaptive deep brain stimulation system for Parkinson's disease. Current DBS systems use constant stimulation parameters, which don't always address symptoms that fluctuate with activity, like gait deficits. This new framework uses real-time decoding of neural dynamics from the subthalamic nucleus to understand the patient's ongoing locomotor activity. It then automatically adjusts stimulation parameters to match the behavioral context. The result was improved locomotor deficits without compromising the therapy's efficacy for cardinal motor symptoms during other activities of daily living. This provides a blueprint for next-generation neuromodulation that is truly personalized and dynamic. Our final theme covers several studies aimed at optimizing the core procedures we perform every day, from managing CSF to prescribing pain medication. First, in a significant finding for infection control, a 4-arm, randomized double-blind placebo-controlled trial in neurosurgery evaluated prophylactic intraventricular antibiotics for patients with an external ventricular drain. 200 patients were randomized to receive vancomycin, gentamicin, both, or a saline placebo. The results were clear. The combination of vancomycin and gentamicin dramatically reduced the rate of EVD-related infections. The infection rate was 24% in the placebo group, but only 4% in the combination therapy group. This translated to shorter ICU and hospital stays and fewer catheter replacements. The authors conclude that this single-dose combination is a safe, effective, and potentially cost-saving strategy to reduce EVD infections. Also in neurosurgery, a large systematic review and meta-analysis looked at outcomes for lumboperitoneal shunts, often considered a secondary option for hydrocephalus. Pooling data from 49 studies in nearly 2,700 patients, the overall shunt revision rate was 25%. However, this risk varied dramatically by diagnosis, with a revision rate of just 10% for normal pressure hydrocephalus, but a high of 46% for idiopathic intracranial hypertension. The most common reasons for revision were obstruction and shunt migration. The authors argue that LPS has acceptable complication rates and that Western countries should consider integrating it more actively into practice, with the caveat that patient selection is critical. Turning to spine surgery, a study from the Michigan Spine Surgery Improvement Collaborative demonstrates the real-world impact of implementing statewide opioid prescribing guidelines. After setting morphine milliequivalent, or MME, limits for opioid-naive patients undergoing elective spine surgery, compliance with the guidelines increased significantly. More importantly, adhering to these lower MME cutoffs nearly halved the odds of patients still being on opioids at 90 days. And for lumbar fusion patients, it also reduced the risk of opioid use at 1 year. Critically, this was achieved with no significant differences in patient satisfaction, functional outcomes, or pain scores. This provides strong evidence that thoughtful prescribing guidelines can curb long-term opioid dependency without harming patient recovery. And finally, a study from Neurosurgery challenges the routine use of early postoperative CT scans after elective brain tumor surgery in children. In a retrospective cohort of 240 pediatric patients, researchers found that in neurologically stable children, an early CT scan never, on its own, triggered an emergency return to the operating room. All 12 patients who required reoperation had preceding neurological deterioration. The neurological exam was 100% sensitive and had a 100% negative predictive value for predicting this outcome. This suggests that a selective, clinically driven imaging strategy can reduce unnecessary radiation exposure in children without compromising safety. And finally, in a paper that is highly relevant to how we all access and interpret medical information, a study in Nature Medicine evaluated the performance of specialized clinical AI tools against general-purpose large language models. Researchers tested them on medical knowledge questions, alignment with clinician judgment, and 100 real clinical queries from physicians. Across all three evaluations, frontier large language models like GPT's successors outperformed the specialized clinical AI tools, highlighting the critical need for independent, real-world evaluation of any AI tool before it enters clinical practice. If you only have time for one paper this week, make it the report in Nature Medicine on the long-term independent use of an intracortical brain-computer interface. This study's demonstration of a patient with ALS using a BCI at home, for years, to work and communicate richly, signals a true paradigm shift in restoring autonomy for people with severe paralysis. Here are the key takeaways from this week in neurosurgery. 1. In pediatric brain tumors, CSF-based liquid biopsy is a powerful emerging tool for molecular diagnosis, showing high concordance with tumor tissue and far outperforming plasma or urine samples. 2. For patients with an external ventricular drain, a single prophylactic intraventricular dose of vancomycin and gentamicin can significantly reduce infection rates from around 1 in 4 patients to just 1 in 25. 3. Implementing evidence-based opioid prescribing guidelines after spine surgery can cut rates of long-term opioid use by nearly half, without negatively affecting patient-reported pain or satisfaction. 4. In neurologically stable children after brain tumor resection, routine early postoperative CT scans appear to have limited clinical value. A selective imaging strategy guided by the neurological exam is likely safer and sufficient. And 5. High-performance, long-term, independent home use of intracortical brain-computer interfaces for communication and computer control is now a demonstrated reality, marking a major milestone for assistive neurotechnology. That's your roundup for this week in neurosurgery. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.